Now, the Blue Poppy team from Letterkenny and Donegal Town recently attended the Colgate Caring Dentist Awards 2025. They had a number of nominations, but are especially proud of Dr.Liidia Dydyn, who won the award for Ulster Regional Caring Dentist, because Colgate were told about the case of a non-verbal child who was in urgent need of dental care, and the her mum wanted to try to avoid general anaesthetic and went to a number of clinics. None of them were able to even do a proper examination. So after months on a waiting list and a lot of concern, she ended up with Blue Poppy, and Dr. Liidia was able to help. So let's find out how now exactly, because Dr. Liidia joins us on the line. Good afternoon and congratulations.
Hello, thank you so much, and thank you for having me today here.
Okay, tell us about this case. It was a 4-year-old girl, and she was obviously in need of some dental care. It was almost a crisis situation, but she's non-verbal
Yeah.
and had a fear of dentists. So, what particularly tricky. So, what did you do?
Yeah, so what I remember the most about that case, that how anxious and overmelted she was, and even how much strength for her it took just to enter the room.
Mm,
And her mother, as you told, she had gone to a few clinics before, and it all ended up with a huge stress for the child. So I knew straight away that it's going to be a little bit of challenge, and my main goal on that time was not just fix the tooth immediately, it more was for her to feel safe and the first of all build the trust. So, step by step, we try to create some sort of environment when she could relax. She could to completely understand what's happening with her right now.
mm,
And eventually, she did accept the treatment for the first time in her life. So we didn't rush at all. It took for us for around 5 appointments. First of all, what I've done, a few simple things as a, like went to her level, said hello. I showed all instruments very slowly, get her time to use to myself, to my nurse, to the dental chair and everything around. So we let her observe first. She didn't go straight away to the chairs. She went around the room, touch wherever she wanted, and obviously that one that's safe to touch. We given her some sort of control. So I think for us was the main thing that we didn't rush. We let her watch some YouTube videos that she liked in the
okay.
dental chair. So after a few appointments, she felt safe in the room, and because it was something that she wasn't afraid, and she did know where she went. So I think that played the main.
So you gained her confidence
Yeah, yeah.
before you could do anything. Because if any of us have a fear of the dentist, it can be all sorts of triggers. Could be the instruments, can be the lights, can be
The
just
lights, yeah.
getting into the chair. Seeing a dentist in all the whites. They're all triggers. So you had to overcome all and more.
Yeah, another thing what we've done with her, because for myself also I do work quite a lot with the children and with the children with anxiety and generally with the patient with a huge dental fear, but her condition was quite severe as she's absolutely nonverbal. So I got in touch with few my friends. They are therapists and they work with the children on the spectrum, so, and I did explain them, and we made some sort of plan for her, the main problem wasn't the just extraction by itself, because it's quite fast procedure. The main problem was an injection and anesthesia. So in her case, what we've done, pop a little bit of anesthesia on the cotton roll and let her taste it, so she got used to the taste.
Yeah.
And then I've done an injection on myself, so she saw how how is it,
Okay.
and there is no fear and stuff like that. She was observing very, very like careful, and actually she did like it, and we got absolutely no problem with the anesthesia after that.
This is probably an extreme case or an extreme example, but I'm sure you come across a lot of children who are on the spectrum and who need to be, reassured and calmed before any work can be done.
Yeah, exactly.
Yeah. And what was the work in the end up? It was an extraction, was it?
Yeah, it was an extraction on the fifth. I think it was fifth appointment when we've done an extraction. At the beginning, we've done on the fourth one, we've done an exam, some X-rays and stuff like that. And in the end of the day, we've done
Mm.
an extraction. Yeah.
Our mum said in comments afterwards that I'll quote her, she helped my daughter take her first step towards trusting healthcare, and that trust will shape her future. So you've probably helped with other healthcare that she might need, not just dentists.
Yeah, and her mother courage also like stood out for myself, because despite everything that they had done through, she still kind of like believed that improvement kind of like was possible. And for myself also, it was like very touching my heart.
Yeah. Uh, um, your empathy for patients that are sort of weary of going to the dentist, young patients in particular. Does that point towards you being a bit scared of going to the dentist when you were small?
No, not really, because my parents, they are dentists.
Okay.
So the dentistry was something for me that I was very familiar, And when we were children and playing with my neighbors, we all the time playing that, oh, I'm a dentist, you're my patient, and things like that. So
Okay. Okay.
it was fine with
You
me.
grew up with it. But again, her mum said at first there was no gloves, no tools, no
Yep.
pressure, and it was all to reassure that this girl that everything would be okay, and everything did turn out okay for her.
Generally, even for the child patient with an anxiety all the time, I advise to keep first dental visits very short, positive, and rather go regular than wait for the pain. And as I told you before, let your child to explore the room first. And I all the time trying to avoid words like pain, needle, or even be brave, because they create some sort of fear. When you say be brave, child expect that, oh, it might be something that I would struggle if they telling me to be brave.
Yeah.
And the children also very copy emotions, like you're the dentist emotions, parents emotions. If everyone very relaxed, they relaxed eventually too. And for the patient with a sensory
Issue. Yeah.
problem, I trying to reduce any sort of noises if it's possible. I'm wearing the loop, so the loops has some sort of like local light, so in that case I don't need to use that huge light that we have connected with the dental chair. So it's kind of like trying to reduce any sort of triggers, and it's all the time we need to allow them watch before any sort of procedure. And yeah, and also like holding any like comfort, either toy or something, the thing that kind of like the object of comfort, it also helps. It's very small adjustments, but honestly they make a very huge difference.
Okay. And if a child is really spooked by going to the dentist and really worried and scared, then sometimes it might take more than one appointment. The first appointment just might be about familiarity, and then it might take a second or a third in order to get the work done.
Yeah, absolutely. And it's better to take that time and because like dental anxiety is very, very common, and people care that fear whole their life, and usually a childhood experience, that medical trauma came from childhood. So I would rather spend more time, but in that case, the person would not have the problem in the future.
Okay. Just a couple of questions before you go from listeners. Someone says, is there anything I can do to stop my teeth grinding?
So the grinding, I would suggest first of all to go to the orthodontist for some consultation, because sometimes grinding could be something else, But the orthodontist could do your impressions and could do some night guards, and night guards would definitely would help. Sometimes we do some Botox on the muscles, and the Botox would relax the muscles as well, So it's a few options, but I would suggest to go to orthodontist, and the orthodontist could suggest which one it's going to be better.
And another caller says, my son has just turned 2. At what age should he first see a dentist?
So I suggest for around 3, 4 years old to come just for a few consultation, no x-rays or something like that. It's more to see how teeth erupting and everything is okay, give some oral hygiene advice, and then keep coming regularly every 6 months from 6 years old, when first permanent tooth start erupting.
Okay, because that's at a time when their teeth are growing and
Yeah,
developing and
they changing, yeah.
yeah. Just one more. I brush my teeth religiously, but should I also floss? Someone who obviously takes good care of their teeth, but they're just wondering should they floss as well as brush?
So you see, when we brush in our teeth, we could not reach completely in each spot of our tooth. So I would say flossing, it's probably around 60% of success of a good oral hygiene. With
Okay.
the floss, we could reach between our teeth, as well as we could reach into some sort of pockets that we all have around our teeth, and properly clean that. The best option to do like very good oral hygiene is to use water flosser, then brush our teeth, and then go with a regular floss.
Okay.
In that case, with a water flosser, we could move out all like food remainings. Then we brush, obviously, and then we floss with a little bit of the toothpaste that we still have in our mouth. In that case, we could reach on the all surface on our teeth. It sounds like it's huge,
Yeah.
but when you kind of get used to that, likely it's going to take around 4 or 5 minutes. It's max, it's more about as a habit, if you take it as a habit,
Okay.
it's much easier.
What's water flossing?
So the water flosser, it's some sort of machine, it looks a little bit as an electric toothbrush, it has some sort of small wee bottle
Yeah.
on the bottom, and then kind of like the body of the machine. And a few heads on top, so the beginning would suggest to choose the small head, the tiny one that they have. And they have 3 levels of the pressure, always suggest start from the lower one. And what you do, you kind of go around your teeth. So in that case, water could reach around your tooth, went a little bit of the pockets. And it also quite good to clean if you feel that food might stuck somewhere. It's gentle way to remove it.
Okay. And we've been talking a lot about children and dental care for kids. But just a reminder that at Blue Poppy, it's all ages. It's adults and kids and all either side. Okay, Blue Poppy Dentistry and Orthodontics in Letterkenny and Donegal Town. Dr. Liidia Dydyn, congratulations again, and thanks for chatting with
Thank
us.
you so much.